Everyone, I'm Dr. Iyantha. I'm a doctor from Sri Lanka. I've been in UK for the past 1.5 years. I came here for the overseas training of my husband. So I'm mother of three. And how did I ace my Plab 2? So fortunately, when I came here, I got the opportunity to work in the NHS as a medical support worker. And also, I did a clinical attachment in dermatology. So during this time, I realized that I need to get my GMC. So for that, I started to apply the GMC in two pathways because it was very difficult to get the Plab part 2, Plab dates. So I also did MRCP pathway 2. So when I was getting prepared for Plab part 2, I tried PACES and unfortunately I could not succeed. So by the time my results were out and for me to get ready for Plab part 2, I was left with 2 months. So this is my story. So let me share the experience and how I ace passing this exam with good marks. So how long will you need to prepare for Plab 2? So it depends on individual to individual, the capacity as well as the time they are ready to dedicate. But I feel minimally 2 to 3 months you will need. So how can you prepare? So there are a lot of information out there. So in the GMC, the blueprint is there and there are various academies and there are various mentors. So study your exam properly and then go ahead with practicing. Have a good discussion group and then practice, practice, practice. Practice makes you perfect. So how many stations do you get in Plab Part 2? There are 16 stations. In the exam, you will have 18 stations, including the tourist station. So for one station, you will get 8 minutes. At the end of the 6 minutes, they will let you know 2 minutes remaining. And then you get 1 minute before you enter the cubicle. So what are the aspects they are going to test you or what are how are you going to get marks? So you're going to get marks of a total of 12 for each marks in the domains of data gathering, technical and assessment skills, clinical management skills, interpersonal skills. So remember, you're getting 4 marks in each of these. So what are the type of stations you're going to get? You will be tested in your medicine, your surgery, your gynae and obstetrics, and pediatric, psychiatry, and there will be ethical scenarios like medical error, angry patient, breaking bad news, and there will be combined stations. So you'll have to face variety of stations. There will be SIMMAN and procedures too. So any 16 stations you could get in your exam. So few tips that I feel will be helpful to you when you are going for the exam. First of all, don't be scripted, be confident and be natural. You are unique and have your own unique nature in these approaches. Have a good smile, greet and enter the cubicle confidently. But before you enter, in the 1 minute that you have to read your instruction, go through the instructions carefully. First thing, note where you are, whether you're in the GP surgery, whether you're in the emergency department, whether you're in the gynae and obstetric department, etc. Then understand your task. After you understand your task, you should enter your cubicle. And then there you will have to greet your examiner as well as your patient. So when you're greeting your examiner, greet your examiner, tell your name and your GMC. Don't rush. You have 8 minutes, but don't rush. And then greet your patient and greet it in a nice way. You can paraphrase the scenario or any approach and start your station. So you'll have to do a data gathering accordingly. And once you finish your data gathering, I will do another video about data gathering in certain aspects in common conditions and as well as uncommon conditions in the future videos. So data gathering is one thing, and then you need to ask patient's concern. So concern should come first. I feel it's better to ask the concern throughout when you're starting your consultation, like end of your first part, better to ask it in that way rather than don't wait towards the end. Sometimes you might not have enough time to deal with it. So what we call ICE, or idea, concern, expectation. This is very important. And always acknowledge whatever the verbal cues or whatever the non-verbal cues that your patient is giving you. And active listening is very important. Listen to the patient, and then don't think about what you're going to ask next, but instead have a good listen to your patient, and then accordingly you ask your questions. Then you'll have to do the examinations, as well as you'll have to give a diagnosis. So for the diagnosis, you can give a definitive diagnosis. If unable, you can give differential diagnosis and go ahead with your management. So when it comes for management, always what is important is a shared care, where you have to get your patient involved in the management. So to do this, give your patient the options and give him a chance to select. Ask his ideas around. Don't rush with your own management. So they give marks for your being a patient-centered management. And always safety net. You need to safety net the patient, safety net, as well as plan for the future follow-ups. And when you're asking questions, always, if it is a personal question or whatever intrusive questions or whatever the questions that need signposting, please do signpost. So these are few tips that I thought will be helpful when you are practicing. And another important thing that I forgot was your gesture. So whenever you're doing your consultation, the way you sit, the way you're looking, all that too matters. So try to have a good gesture when you're doing. So yeah, that's all the tips that I will have to give you, but there will be many tips accordingly that I would like to discuss in the future videos. If you do like my channel, please do subscribe.